not able to. Thank you, sir. So good afternoon or good morning. I guess it's still morning time. Welcome to the 2023 CoC program competition Q&A. So this meeting is intended to function as a space for potential applicants or stakeholders to ask questions about the 2023 CoC program competition. So when you registered for this event, you should have seen a handful of other materials that we shared along with the registration link that might, or that were hopefully intended to help your understanding of the Continuum of Care program. So I'm going to stop talking about all that because we're going to talk all about CoC program stuff and just kind of start moving us through the slides. And specifically, I should probably introduce myself. My name is Jim Ward. I'm the Director of Planning here at Texas Homeless Network. So I work with these lovely folks from THN and many of you around the state to design and implement programs to address homelessness. Hope Axton, would y'all introduce yourselves?
Yeah, hi there. I'm Hope Rogers. I use she, her pronouns, and I'm the CoC performance manager for Texas Homeless Network.
Good morning, everyone. I'm Axton Nichols, use he, him pronouns. I'm the CoC performance coordinator.
Great, thanks guys. And I'm gonna leave this poll question up for just another minute or two as we're kind of talking about the agenda. So the idea here, folks, is that people will have at the end of this meeting a basic understanding of the Continuum of Care program, a basic understanding of the CoC program application process, specifically how you will submit an application for consideration, and then next steps that applicants can work on now while the CoC program NOFO is pending, or notice of funding opportunity is pending. And we'll also leave plenty of time for questions and answers. So if you did have the opportunity to review the materials in advance of today's session and you have specific questions about those materials, we'll have time in this meeting to address those. And with that, I think I'm going to pass it to, oh, one last thing. If you have questions, please put them in the chat. Craig and I are monitoring the chat, and we'll do our best to get them routed to the presenter at the appropriate time, but we'll do our best to answer all questions in this space today. That's it. Thanks.
Thanks, Jim. If you can go to the next slide, please. So starting with some foundational knowledge, we as THN serve as the lead agency and the collaborative applicant to the Texas Balance of State Continuum of Care, which means we are tasked with carrying out the statutory requirements of operating at CoC, including running the local competitive application process for the Continuum of Care program. So HUD defines a CoC as the group organized to carry out the responsibilities required under the CoC program in a given geographic region. For us, that is the Texas Balance of State Continuum of Care. A CoC is also a community-based planning network for homelessness assistance, which includes stakeholders like you and other providers throughout the Balance of State. A CoC is also the geographic area covered by a community-based planning network, in addition to a program operated by HUD, which is what we are largely here to talk about today. Next slide, please. So this is a map of Continuum of Cares in Texas. I'm sure this is a map that many of you are familiar with. We are one of 11 CoCs in the state of Texas, and we cover the 215 counties in orange. Go to the next slide. So HUD defines the purpose of the CoC program as a method for advancing effective use of mainstream resources, advancing community-wide commitment towards ending homelessness, providing funding that allows eligible entities nationally the ability to rehouse individuals and families experiencing homelessness while also minimizing trauma and optimizing self-sufficiency. So I would encourage you to use these items as a framework for what you're considering as you're considering applying for funding in FY23 and beyond. And you can expect to see some questions in our application that center around these items. Moving on to commonly funded housing interventions in the CoC program, which HUD refers to as project components. In general, the CoC program funds housing components and supportive services that use a housing first approach, which is a low barrier approach to programming where folks are screened in rather than screened out. There are no prerequisites or service requirements to gain entry or maintain their standing in the project. The primary housing components include rapid rehousing, which combines a short to medium term rental subsidy with wraparound services and holistic case management. Permanent supportive housing is very similar to rapid rehousing with a distinct difference that PSH is not time limited, whereas rapid rehousing is limited to up to 12 months of assistance. And PSH is also intended for folks who are experiencing chronic homelessness, which is defined as having 12 months of literal homelessness and having an accompanying disability. Additionally, there is a relatively new intervention type called the Joint Component Transitional Housing and Rapid Rehousing Project, which has been around for a couple of years. This is sometimes referred to as the Joint Project. So this project type combines both transitional housing and rapid rehousing components into a single project where participants can benefit from one or both components or even move back and forth between the two based on the unique needs of each household. Client choice is central to this project type, and providers must make both component options available to participants throughout the duration of their enrollment. So you can't, in this project type, you can't, for example, require that all folks enter transitional housing and stay in transitional housing for a period of time and then move into rapid rehousing later. You have to center what the client choice and what makes the most sense for their needs and their household.
All right, thanks, Hope. So Hope just went over the types of projects that HUD will fund. So now we're going to look at the types of services that can be funded within those projects. So the main one with the housing interventions is going to be tenant-based rental assistance, or TBRA. So this is a rental assistance subsidy that would follow a participant. Typically, participants would have their own lease in market rate housing. Sometimes these are project-based where the project owns or operates the housing, but generally this is just standard market rate housing apartments in the community where someone would have their own lease and the project helps them pay for those for the cost of rent. So in order for a project to pay for rent, the rental cost must be reasonable and they must meet fair market rent requirements. Units must also pass HUD habitability standards, commonly known as the housing quality inspections. So it's very similar to the housing choice voucher or Section 8 inspections that have to occur before like HUD or Housing Authority will pay for a unit. Another type of thing HUD will fund is for supportive services. So these supportive services are generally connected to rental assistance, and this is the kind of services necessary to help people stay housed. So this would include like wraparound case management services, mental health services, substance use treatment, like outpatient services, educational and vocational training. So in general, all of CoC programs are expected to provide pretty robust supportive services to support the people in their projects. HUD will also fund the costs of participating in the Homeless Management Information System, or HMIS, or if you are a provider that exclusively serves survivors of domestic violence, you may be using a comparable database, but those costs can cover cost for data entry, reporting, fees to access HMIS, equipment to access HMIS if necessary. The other category that HUD will fund is administrative costs. So administrative costs are capped at 10% of the award amount. So these costs can cover program management and agency administrative support. So the flip side of that, what HUD will not fund through the CoC program So HUD will not fund emergency shelters with continuum of care funds. So that includes the cost of creating or standing up a shelter, like capital costs, and would also include costs related to running the shelter, like staffing and utilities. So basically, HUD will not fund shelter costs through the CoC program. With limited exception, the CoC program will not fund temporary housing. So the main exception is the project type Hope mentioned, the joint component project type. That does include some temporary housing, but that's just part of the project. HUD typically will not fund standalone transitional housing projects. Those are not eligible. And finally, homelessness prevention. So families that are at risk of homelessness or doubled up or otherwise do not meet the HUD definition of homelessness will not qualify for assistance. So HUD does operate other types of programs that can fund some of these things, but shelter costs, temporary housing, and homelessness prevention cannot be funded through the CoC program.
In general, hey y'all, it's me again. In general, when HUD is looking for applicants to administer the CoC program, they're looking for 501c3 nonprofit organizations or other private nonprofits, state and local governments, or instrumentalities of local governments, which would include things like public housing authorities, community development departments, and various other entities within the structure of local government. And public housing authorities. Public housing authorities are eligible without, on the same basis as any other applicant to administer the CoC program. Some critical components of eligible applicants that everyone has to comply with, including state and local governments. Applicants must be active in the system for award management or SAM.gov. So you must have an active SAM registration at the time of application. You must have a unique entity identifier. This is formerly what was known as the DUNS number or the Duns and Bradstreet number. That unique entity identifier is actually a prerequisite to get your SAM registration activated. And then finally, you must be eligible to do business in the state of Texas. So you must be incorporated and have paperwork on file with the Secretary of State. You have to be eligible to draw down funds from the federal government and eligible to do business in the state of Texas.
So before we get into what the application looks like at the individual project level, I think it's kind of important to take a step back and look at what the process looks like as a whole, which is what is called the collaborative application, which contains 3 distinct parts. The first being the CoC application, which is something that we submit as THN on behalf of the CoC and requires us to respond to a series of questions that speak to how the CoC works and what we're doing as a CoC. So we also submit an application while individual projects are working on their application. This application is posted online prior to submission for stakeholder review and feedback. Second is the priority listing or ranking. So we, as the CoC lead, are required to evaluate all project applications submitted in the competitive process and then rank them competitively, which becomes the priority listing, which is also something we submit on behalf of the CoC following approval by our CoC board and online posting prior to submission. And generally, projects are funded in the order of our priority listing. And last, but certainly not least, is the individual project applications from eligible entities throughout the balance of state. So these include the materials submitted by project applicants to both HUD and to the CoC, which we'll talk a little bit more about later in this presentation. So this is a very simplified visual of what the competition looks like for the Texas Balance of State Continuum of Care, starting with THN developing an RFP or request for proposals, which spells out exactly the amounts of funding that are available, the types of applications that we're seeking, all of the eligible activities that you can apply for, budget considerations, in addition to developing project applications and project evaluation criteria, which then go to our CoC board for review and approval. So following approval from the board, we post these materials online on our CoC program landing page, and also communicate the availability of these materials through our competition listserv, which is the listserv that if you received this email about this webinar, then you are signed up for the listserv, but that listserv link is linked later in this presentation if you have not signed up. So in this stage, we also host trainings and provide technical assistance to applicants. Something important to note here is that once HUD releases the NOFO or Notice of Funding Opportunity, we cannot provide any technical assistance to any applicant that would give them a competitive advantage over other applicants. But that said, we can and do provide lots of other technical assistance and support throughout this process. And moving on to the third stage in purple, once applicants submit individual project applications to the CoC that meet our minimum threshold and eligibility requirements, these applications and all of the materials go to what's called the IRT, or Independent Review Team. The IRT is a group of stakeholders throughout the balance of state that are tasked with reviewing and scoring applications based on some predefined scoring criteria that is approved in the first stage of this process. If you are a renewal project, this process looks a little bit differently, but new projects will always go to the IRT for review. And then based on the IRT scores, THN then ranks projects in order of their score. And then finally, we package up everything and submit the collaborative application to HUD for submission. And all of this process occurs in 90 days from start to finish, with about 2 to 3 weeks for applicants to submit all of their materials. So it is a pretty quick process. So I'm glad folks are joining early and getting ahead of it. If you go to the next slide. Oh, this is accident.
All right. So as you may be aware, HUD has not yet released the CoC program competition NOFO for this year. So we're currently kind of working based on what they have done in years past. So as far as kind of what we know at the moment, so you know HUD will be releasing a NOFO for the CoC program competition. We don't know exactly when, but we would expect that to be soon. Once HUD releases that NOFO, THN will then draft the local competition request for proposals, or RFP, in response to the NOFO. So often the NOFO will lay out specific priorities that are unique to that year or something. So a lot of that information has to be incorporated in the RFP that goes out. As far as the deadline for CoCs to respond to the NOFO, it's likely around the end of September. Again, this kind of depends on when HUD releases their NOFO, but based again on schedules from years past, we would expect it to be around the end of September. And finally, THN will solicit all application materials to a local application contest or application through the Texas Balance of State Grant Management Platform called SurveyMonkey Apply, or sometimes we would just refer to it as Apply. So that is where applicants will go to submit all their materials to apply for funding, and then THN gets the information from there and sends it to the IRT and uses that information to evaluate projects and complete the local application. So what we don't know. So there are a lot of unknowns at the moment. The biggest one being we don't know exactly when HUD will release the NOFO. Again, we do expect that would be soon, but we can't say for sure. We also can't know for sure what the NOFO will contain. So typically a NOFO will contain bonus funds. Those are funds that are available to fund new projects or expansions for projects. Those funds, bonus funds, are typically divided into 2 pots. the CoC bonus funding and the DV bonus funding. DV bonus funding being specific for providers who serve survivors of domestic violence. Typically, HUD will offer both of those pots of bonus funding, but the individual NOFO that comes out could restrict that. Or it's also possible that there may not be any new funding or some combination of new funding available. So again, typically there would be funding for new projects available, but sometimes that's not the case. And then what we don't know, HUD may fund renewal projects at 95% of the CoC's annual renewal demand. So typically there's the HUD sets the annual renewal demand is for a CoC is 95% of the total funding that they awarded last year for projects, and saying all projects that are placed in tier 1 in our project ranking, there's 95% of funding available for that tier, and anybody who scores or is placed in tier 2 is at risk of not being funded. But the actual cutoff of how much funding HUD makes available for tier 1 can be set in the NOFO, and while it's usually 95%, we don't know that for sure.
So I don't want to spend too much time on this slide because Axon already touched on some of these things. But this is a visual of the types of applications that are generally available in a given year and who is eligible to apply and what types of projects you can generally apply for. As Axton mentioned, all new projects must be under either the CoC bonus or the DV bonus. And as a CoC, we limit DV bonus applications exclusively to victim service providers. So folks who are exclusively serving victims and survivors of domestic violence. Again, all of this will be laid out in the RFP when that is available. So I would highly, highly encourage you to read that document in its entirety when it's available. So moving on to what the application looks like for the individual project applications, which is why I'm sure all of you are here today. There are a few distinct phases and components of this process, starting with what we call the threshold verification. So threshold verification requires applicants to respond to a limited series of questions that allow us to verify that you're eligible to operate a CoC program. So here we collect some basic information on the organization, such as your EIN number or your employer identification number and your unique entity ID in SAM.gov. We also collect the proposed geographic area you're proposing to serve, the type of application you're planning to pursue, and some limited details on the project itself, like anticipated budget, general cost allowability, and anticipated activities. So all applicants that meet the minimum threshold requirements to operate a CoC program identified in the RFP will advance to the full application stage, which contains a much longer series of narrative questions and required uploads. So the types of questions you might see here really range from your organization's financial and administrative strategies, your agency's capacity, and component-specific questions like how your project advances the priorities of the CoC, the types of interventions that you'll be used, detailed budget information, and other details that speak to the activities of the proposed project. This section also includes a monitoring history report, which is a series of questions about any state or federal monitorings your organization has been subject to in the past couple of years, and what the results of those monitorings were. We also require folks to upload their eSNAPS applicant profile, which is essentially a face sheet for your organization. eSNAPS is the application platform that HUD uses to facilitate this process. We have a link later in this slide that provides some resources on how to create an applicant profile if you don't already have one. So in addition to the applicant profile, we also collect the project application in eSnaps. So this is what you're working on, or what applicants work on alongside of their SurveyMonkey application. So folks submit 2 applications, one through SurveyMonkey, which is what's submitted to THN for review. And then alongside that, that process, folks are also working on their eSnaps application, which is what HUD sees. And then all of that gets packaged up together and submitted to THN for review. We also require folks to submit a certification of consistency with the consolidated plan, which is a HUD required form and a HUD generated form that requires a local signature from your certifying jurisdiction, which is often a branch of your local government. And then after applicants submit all of these materials to us, we conduct a quality review of application materials and provide feedback or needed corrections. We generally do this through a series of meetings and emails, so both verbal and written communication. From there, all application materials or new application materials go to the independent review team for assessment, which are then ranked for the priority listing. And finally, applicants submit their eSnaps application to HUD in advance of their deadline.
So I wanted to, hey y'all, it's Jim again. I wanted to spend just a second on this this slide because it is a literal ton of information. I know we got a question in the chat earlier about the, you submit one application to HUD and one application to THN. So I want to address that really quickly. And also just let everyone know that each of the bulleted items on this list in the threshold verification and full application stages are detailed in painstaking detail in the request for proposals. So if you have specific questions during the application period about, well, what's in the full app, or what do I need to submit for the full application stage? Like all of that information is detailed in the request for proposals. And again, I know I mentioned it earlier to, encouraging folks to review that. It is essential that you review the request for proposals in order to be able to successfully complete this process. The other thing that I wanted to point out, and this is separate from maybe prior years. So if it's been a few years since you've applied for CoC program funds through the balance of state, historically, we have actually scored projects on the eSnap project application. We have since moved away from that process. So as you are kind of navigating this process, you can reach out to Texas Homeless Network staff for support in completing the eSnaps project application. Both the eSnaps applicant profile and the project application are very thoroughly documented on the HUD exchange. Those are, again, HUD applications. So like we can't tell you, specific like technical questions about the application content would of course need to go to HUD, but as far as navigating the platform and successfully submitting the application, that's something that we can help y'all with. So I just wanted to point that out, and I'm going to pause for a second to see if there's additional questions. It looks like somebody just introduced themselves in the chat, so no questions about this right now, but we are coming up on the Q&A section here in just a minute, and I would invite you to ask your questions then. So you might be thinking to yourself, well, what are the CoC's priorities? What are the balance of state priorities? And they are listed for you on this slide. They are also linked, so when you get the PowerPoint presentation after this meeting, I know there's been a couple of asks for that in the chat. One, you will get all of the slides that we are reviewing with you today, but there will be significantly more content on the individual pieces of the project application for your review, kind of asynchronously. And then if you have questions, you can reach out to us. But on this slide in the slide deck, you will get a link to the actual, there's a web page with the CoC's priorities that goes into more detail than these bulleted items here on this slide. But what we're talking about is, again, a community-wide commitment. HUD would expect that CoCs are working collaboratively to address homelessness. So that does not necessarily mean that all of the organizations in your community need to kind of pile together on one application. There needs to be one primary applicant that is the recipient, and then of course a recipient could subaward some of those funds out to a subrecipient if they so chose. But really what we're looking for on community-wide commitment is evidence that you're not developing project applications in a silo. We want to know who your partners are. We want to know what their role is. We want to know everything that we can know about kind of how this project would fit into the community context or the community landscape of your community. So John, I know you're from Abilene, right? If we would want to know all about your partners that you are bringing to the table with this project. Specifically, and this next item is leveraging housing or healthcare resources. This is a relatively complicated priority. This is deriving from HUD. They have in the last 2 years required that CoCs demonstrate that they are bringing additional resources to the table. So when we talk about leveraging housing or healthcare resources, that may look like a partnership with your local public housing authority or an affordable housing developer, or a partnership with your local mental health authority or a private licensed clinical social worker or family therapist or LCDC. Those partnerships are crucial. I was going to say critical and crucial to scoring well in this process, right? HUD is ranking CoCs to the extent that we can bring these resources to the table. And so in turn, we have passed that down to the applicant. We are anticipating that this will be a big part of this year's competition. In the last 2 years, it started off as this requirement was worth bonus points for CoCs. So a CoC could bring some nominal amount of additional leveraged resources to the table, and they would get bonus points on the CoC application, which in turn impacts project applications. Last year, this was actually worth 14 out of 200 points on the CoC application was bringing additional leveraged housing or healthcare resources to the table. And so we're anticipating that they will continue to make it a scored component of the project application. We also think it's obvious, it's just really important to kind of extend federal dollars as far as they're able to go. We would expect that applicants have a landlord engagement strategy. So, we want to know about how you're engaging landlords in the market and in your community specifically. We would also expect that you have staff that are trained in SOAR, which stands for SSI/SSDI, Outreach, Access, and Recovery, which is a specialized program of the Social Security Administration that accelerates the applications of people who have experienced homelessness or who are experiencing homelessness. That's not the only federal benefit that HUD would expect that administrators of the CoC program are bringing forward as a resource for their participants, but that is the primary one that we are focusing on because it's named explicitly in the application. Of course, housing first, I think, is a priority of HUD. It has been for the last probably 5 to 7 years, and we're anticipating will continue to be. This idea of targeting the hardest to serve. So this comes from the idea and understanding that many communities around the balance of state are experiencing explosions in, that's such an awful term, but a real increase in unsheltered homelessness. Well, places like San Angelo, Texarkana, right? Like everywhere, I think, is kind of struggling with how to address unsheltered homelessness right now. And so we want to know how these projects are going to contribute to your community's efforts to reduce unsheltered homelessness and folks with severe and persistent needs that are not addressed through other community resources. Additionally, persons with lived experience of homelessness should be at the table when you're developing your project design and implementing these projects. So there are, obviously HUD requirements around participatory experiences, or people with lived experience participating like on your board as an example, but we really want to know how they're contributing meaningfully to how you're engaging with other people with lived experience. And then targeting underserved communities. This is going to vary by community because each community kind of has their own distinct needs. So like, again, in San Angelo, that could be really a singular focus on the unsheltered population. In Abilene, that might be a singular focus on youth, or so on and so forth. So we want to know who you're targeting with these funds, with the understanding that they must target people who are experiencing literal homelessness as defined by HUD. So I feel like I've talked way more than I intended to talk on this slide, and that actually brings us to the Q&A portion of this meeting. I know that there were some questions in the chat, and so I'm going to go back and just address the ones that I see right now. And the first one was from Michelle Wormley. Typically, it's been 100% for renewals. Do you know why the change? And I think, Michelle, you're talking about this slide here where HUD may fund renewal projects at 95% of a CoC's annual renewal demand. So that's somewhat, I can understand why you might be surprised at this slide. If a renewal project is selected for funding and they are in tier 1, they will be funded at 100% of their prior year's request with adjustments for FMR. That 95% is the amount that's available to the CoC in tier 1. So that by definition means that not all renewal projects will fit under tier 1. I guess theoretically, and I think some CoCs might actually do this, they cut 5% from each project so that everyone fits under tier 1. We have historically taken the approach that if you score to be in tier 1, you will be in tier 1. If you score to drop into tier 2, you will drop into tier 2. But that 95% of a CoC's annual renewal demand is actually more in line with what they have historically done prior to COVID. The pandemic actually, so for a brief history for folks that weren't kind of in this space at that time, when COVID hit, HUD actually waived the competitive application process for 1 year. So they just funded all of the renewal projects that were eligible for funding at 100%. There were no new projects. And then the following year, they actually funded all renewal projects at 100%, including folks that would have dropped. So basically, they made it to where all renewal projects would fit under tier 1. And then they created CoC bonus and DV bonus for new projects. We think that they're getting back to their pre-COVID approach. And a lot of that's actually driven by Congress. You know, the CoC is a competitive application process, and Congress would expect that that there's competition, which I have my own personal thoughts on, but that's kind of what it is. So I don't know, Michelle, if that answers your question or not. And while you're typing in the chat, I'm going to move on to the next question, which looks like it's from John Meyer. Is there any thought that bonus might only be for rural and DV housing projects? Ooh, no, I think we're anticipating a traditional CoC bonus. So I think a CoC bonus that would be open to all eligible applicants CoC wide. So I'm not sure, maybe you've seen something that I haven't seen, and I would be happy to learn more, but we're anticipating that the bonus funds, or those funds that may be available to create new projects outside of like a reallocation situation, will be open to all eligible entities within the balance of state and not designated by geography. We do anticipate that, to the second part of your question, that DV housing projects, that there will be a specific DV bonus. Congress actually appropriated the funds to make available approximately $50 million for DV bonus nationally. And so then HUD applies a formula to determine how much each CoC would theoretically be eligible for with DV bonus. By my calculations, that should be somewhere in the neighborhood of $5 million CoC wide, but it's certainly not guaranteed. And all of that will be both in the notice of funding opportunity, but also in the request for proposals in terms of how much is available for which type of funding. So Michelle, I think your question here is potentially a misunderstanding. So the CoC plan to address unsheltered homelessness was specific to that, and I'll read your question out loud, but the CoC plan to address unsheltered homelessness was specific to that funding application. So there are references in that plan to specific components of the supplemental notice of funding opportunity. So rather than reworking that plan, because I think if we're, kind of being honest with everyone, that was written in response to a funding request, and it doesn't necessarily reflect what the plan would have looked like, kind of both in syntax, format, and flow, if we were writing a plan to address unsheltered homelessness. And what we are moving forward from that is instead the priorities that we developed through our stakeholder input when we did the, series of webinars to gather feedback from CoC members, work with our lived experience committee at THN, and then work with various stakeholders in that review process. So if you are looking specifically at the CoC plan to address unsheltered homelessness, one, thank you, because I don't think anybody ever really read that. But two, you don't need to focus as much on the plan itself and focus instead on the priorities in that plan. So references to eSNAPS applications, screens, et cetera, are non-relevant for this competition.
I think just to add to that, the abbreviated version of the plan, which just contains the priorities, is linked in this presentation. So Michelle, I think you're referring to the plan that went out to all renewal projects. I am glad you read it, and because we encouraged all folks to read that. But I think if you take a look at the abbreviated version linked in this presentation, it'll make a lot more sense.
John asks if expansion projects fall into tier 1 or automatically fall into tier 2. So this is thank you, John. It's a great question. It's a great segue into our CoC's ranking policy, which is available on the website, but not necessarily, right? The line between tier 1 and tier 2 will depend on scoring. So it is possible for a renewal project that scores in tier 2 to actually fall below a new project, such as if there was I'm going to use a hypothetical scenario, like if there was a really poor performing renewal project, and that project just did not do well on scoring at all, it is possible that there would be new projects that would bump that down into tier 2. It doesn't happen that often, but it certainly is possible. Expansion projects getting into tier 1, however, I think is a little bit more of a challenge. The policy is not written that way. So an expansion project itself is always going to be somewhere in tier 2. And then Gabby Fuentes asks, for DV bonus funds, if allotted this year, will programs need to include a description of the vulnerabilities experienced by survivors responding to the focus on serving the hardest to serve communities, or how will those funds be prioritized? Yeah, that's a really good question. So HUD does ask specific questions for DV bonus funding. And so we won't know exactly what's in the DV bonus application until HUD releases their notice of funding opportunity and the accompanying documents that go along with that. But I would anticipate that there will be questions specific about your experience serving that specific population. Obviously, we want to know all about what you're planning to do, and really a lot more questions about the experience of the applicant, more so than the hardest to serve communities. And I'm talking specifically about the DV bonus project right now. Those projects, like all of the others, are scored. The scoring will be in the request for proposals. So you could, basically complete the application, and while you're completing it, score yourself as you're kind of going along to kind of get an idea about how that project will score. And then historically, the board has approved projects based in raw score. So I don't know if that really answers your question. It is kind of hard to say, how an individual project would be prioritized, but we are definitely looking for applicants with experience serving the population that are targeting folks that are eligible, of course. Survivors, obviously, there's a little bit of a difference there in terms of like I know y'all screen based on lethality and not necessarily vulnerability the same way that like a quote unquote mainstream provider would prioritize, but we want to know about all of that. We want to know how you're prioritizing your project participants, et cetera. And it looks like Hope put some stuff in the chat about the ranking policy and the review and scoring policy. Does that answer your question, Gabby? Okay, great. And I think that actually gets us to the end of the questions, unless I missed anything, y'all. Did I miss anything? And so now it's just kind of open.
Yes.
Oh, I'm sorry.
Yes. Jim, again, I guess my question is, on the screen 4A where it makes reference to certain letters attached in eSnaps, where do you find that?
You can actually find it in the, well, you can find it on our website for sure. I'd have to dig around to point you to the specific page that it's on in the consolidated application. Yes.
I think so those specific screens were specific to the supplemental NOFO. So Michelle, I don't believe you had applied through the supplemental NOFO last year, so I don't know if you would be able to see those attachments.
Well, so you will be able to see the completed materials and what we submitted to HUD to view the letters that are referenced in that plan. I just don't know exactly what page they're on in that document, but I can find them and point them out to you if that would be helpful, Michelle.
Yes, that would be helpful.
Yes. Yeah. Again, those specific screens in eSnaps this year are not likely to be relevant for a renewal or a new project.
Okay. Thank you so much, guys.
Yeah, absolutely. I'll follow up with you though via email because I need to figure out where those things are at just in case I get it again. Any other questions? And like Michelle just demonstrated, thank you, Michelle. You can come off of mute and ask your question. You don't have to type it in the chat if you're not, I know we all type a lot. You don't have to type. You can come off mute and ask your question. You can also send us emails. Of course, we'll talk about contact information here in a few minutes. But we have about 13 minutes remaining in this hour and wanting to make sure that folks leave this space with a better understanding than they came in. So I'm just going to stop talking. I'm comfortable with silence, believe it or not. I talk a lot, so you wouldn't guess that. But while folks are thinking about their questions, I did just launch a new poll. So we have a few more questions for you before we go today. But I'll let folks answer those questions while we are just kind of hanging out together. If you have any questions, there's nothing that's off limits right now, y'all. So please feel free to ask away. Oh, and you do need to scroll to get to the third question. There's 3 questions in this poll pod. So if you don't see the third, you just scroll down.
There's another question in the chat, Jim. I don't know if you want to take it or one of us.
Yeah, that's a really great question. So the question in the chat is, what are the pros and cons of rapid rehousing versus permanent supportive housing? And that is such a nuanced question. I'm really glad that you asked. So I think it's going to depend, like a lot of things in the HUD world, it depends, right? It depends on a variety of factors. One, I think what are the resources that are available in your community right now, right? So I'll use an example, a hypothetical example. Let's just say in San Marcos, there's 5 permanent supportive housing projects and no rapid rehousing project. Data shows us that rapid rehousing is really geared towards the bulk of people experiencing homelessness in a given community. Permanent supportive housing is really designed for people experiencing chronic homelessness. They're like really visible folks that are sleeping outside. Maybe they're sleeping on park benches or bus stops in the downtown area. Permanent supportive housing can better meet the needs of folks on a long-term basis. Rapid rehousing is really geared to stabilize a household and get them back to a place where they're re-entering market rate housing in less than 2 years, or they are, re-entering the workforce and able to afford, affordable rents at a rent-controlled property, like a tax credit property or something like that. So I think the main consideration, if I were an applicant in this cycle, would be an assessment of what exists in the community now, and maybe even like what's going to come online in the community in the next few months. But it's really kind of hard, like pros and cons are, other than that, they're very similar to administer, right? Like you're going to get a rental assistance line under both projects, as long as you request, of course, the rental assistance line. You would get supportive services provided that you request those supportive services. So they're very similar administratively to administer. And I don't know that I would say that there's cons of either. They are better suited to different situations and different people, if that makes sense. I don't know, Hope or Axton, would you add anything to that?
Yeah, I think the only thing I would add is that, permanent supportive housing has a much more limited eligibility criteria than rapid rehousing. Yeah. So it's intended for folks who are experiencing chronic homelessness, so long-term homelessness and an accompanying disability, whereas rapid rehousing can also serve those folks in addition to folks who are experiencing literal homelessness. So in rapid rehousing, there's no required length of time that they were experiencing literal homelessness, just that there is a current episode of homelessness. So yeah, I would think that the biggest difference between the two is the population that you're serving. And in PSH, you are serving the most vulnerable in your community generally. But those folks can also be served through rapid rehousing as well, if they're appropriate for that.
And then Tatalio, I see that you have another question below that, and then I see that there's also a question from Jonathan Harvey. So I'm going to answer your second question, and then we'll go to John, your question, or Jonathan, your question. So that is going to be dependent on the RFP. The CoC board historically, at least over the last couple of years, has asked applicants to prioritize their energy on a single project application. And the primary reason for that is that even with experience operating federal programs like CoC, bringing one of these projects online is a significant administrative endeavor, which most organizations, I think if you ask them, had they done both, would probably decline to do it again because it's just simply too much and too much to do well. So there will likely be something in the RFP that limits project applicants to a single project application, single new project application. So I think I hope that answers your question, to tell you. I know my personal opinion doesn't matter a whole lot, but I would highly advise against trying to bring two of these online at the same time. And then Jonathan, okay, so your question is a little bit more nuanced. So it says, we're looking at issues with double dipping. If we are aware that someone has received federal or state assistance in the previous year, can they still be assisted by this program? We have a number of individuals that may receive assistance from a combination of agencies in the area. Yeah, oh, that's a really good question. So it's different to some extent from like state emergency solutions grant program under the CARES Act, which you had to like, demonstrate your that folks you weren't duplicating services. One, there are statutory limits on the types of services that you may combine in a single unit. So there's that part, right? Like you couldn't combine rental assistance from the CoC program with rental assistance from the ESG program with rental assistance from SHR or like HHSC housing supports in the same unit. But it is permissible to have some folks being served by, let's say, ESG or some other rental assistance project, and then be supporting them with the supportive services component of the project itself. So I don't know that that really answers your question, but like if I'm understanding in its truest sense, you cannot duplicate state or local resources with these funds, right? You cannot replace state or local resources with these funds. They are intended to be an expansion of what exists in the community right now. So if you do have folks that are already receiving some other type of rental assistance and supportive services in that, at that time, they would not be eligible for the CoC program. The primary eligibility consideration for the CoC program is the night before you encountered that household, where were they sleeping, right? And if the answer to that question is they were sleeping in a unit that was funded by an agency or funded by themselves, they're not eligible for the project at that time. So it definitely can get a little tricky, especially when you're trying to like blend different funding options that you have available to you to make sure that you're not duplicating services, as it were, for another entity. Does that help, Jonathan? Great. Okay. That's a really good question. Oh, I think we got some more here. So Gabby asks, does the eSNAPS application require identifying information for participants that receive services, or are questions specific to the program? Thinking specifically about the barriers some DC, or I'm imagining that might have intended to be DV programs experience in their focus on maintaining privacy of survivors. No, that's a great question. So the eSNAPS application will not ever ask you for addresses or anything that would be personally identifiable to a participant. In fact, there are like specific workarounds. Like they don't even want like the address of your administrative office if that happens to be a DV shelter, right? Like VAWA is a real thing in the Continuum of Care program that entities have to navigate. So I don't know that I'm answering your question specifically, but like HUD is very well aware of that. And so they do craft their applications, and as do we, that maintain survivor confidentiality and privacy. That said, something that we didn't talk about today is the changes to VAWA that are coming. HUD published a letter yesterday. The 2022 VAWA reauthorization changes category 4 of the literal homeless definition, tweaks it just a little bit, and has some other changes that are specific to the CoC program, which we did not address in today's presentation. But yeah, we are definitely well aware and want to make sure that we're maintaining survivor confidentiality and privacy to the utmost extent. Yep, no problem. And also, I don't know, Gabby, if you got this invite from TCFV, but we do work closely with the Texas Council on Family Violence, not only, before y'all apply, but to work on, oh, that's right. Like last year, we worked with Molly Thibodeau and Molly Boyles to develop the application content for a DV bonus, if that makes sense. And we're at 11 o'clock, so I'm going to stop talking right now. And if there are any additional questions, please email us. I'm going to go ahead and move us to that slide. There is a resource list. We didn't talk really about what applicants can do right now, but it really boils down to signing up for competition updates from us so you don't miss anything. We'll put out something when the NOFO comes out. We'll put something when the RFP comes out. We'll put something when the application's closing. Everything that we communicate to applicants is coming through that competition listserv. We will also do direct contact for renewal applicants, but it's essential that you sign up for the competition listserv. The SAM registration, if your SAM registration is expired or it may expire in the next 3 months, would highly encourage you to visit sam.gov. They made a migration from DUNS to UEI last summer, and they're still feeling the effects of that. So highly encourage everyone to go on sam.gov and check out your SAM registration and make sure it's still active. Update your organization's eSNAPS applicant profile. And then some of these resources here below, Review HUD resources in the CoC program are for your reference. They don't really have anything necessarily to do with preparing for the application. However, it is essential that you understand what HUD is asking. If you need to get in touch with us, please email txboscoc@thn.org. That will go to an email box that's staffed by me and my team, but also other departments. So I don't know what would happen for all three of us to be out on the same day, but someone will see that email as soon as it comes through. And then either Axton, Hope, or myself will reply to you. So Michelle asked, where do we sign up for competition updates? Ooh, and then looks like both Hope and Axton were hot on the chat box with the competition listserv sign up sheet. You are on the listserv, Michelle. All right, everyone. Well, I'm going to stop sharing my screen. If there's no other questions, we can shut it down. Oh, hey, Michelle.
Hey.
And yeah, we look forward to it.
Hey, Michelle. Good to see you on camera.
You too. Hey, everybody. Oh, hey, Mary.